Hi there, my name is Dr. Ann-Louise Lockhart from A New Day Pediatric Psychology here in San Antonio, Texas. So I've spoken a few times about executive functioning disorders, and I wanted to talk a little bit more about that and what it can look like. So ADHD often can look like a variety of different types of problems or disorders, and those can include sensory processing disorder. It can also look like some kinds of anxiety, depression, and even sometimes autism spectrum disorders. So they all have different bases in terms of what happens with each of them, and they all present slightly differently, although they can have some overlap. Now, ADHD can look like those things, but it can also look like oppositional defiant disorder, and it can just be typical childhood behaviors. Kids go through periods of wanting to be independent, to have their own voice, to be heard, to be in control, and those can look like a disorder, although it's just part of their normal development. So it's really important not to what we call over-pathologize a child, which means don't give them a diagnosis if they don't really meet criteria for one. So a child who is having tantrums or meltdowns, which there is a difference, those can be because of a sensory issue. Maybe they're taking too much into their senses in terms of through their hearing. A sound is too loud, or a piece of clothing is too tight or too loose or too itchy or too scratchy, or maybe they lose their balance easily, or maybe they're not really sure of where their body is in space. These are all different things that are part of the sensory systems, which there are about 8 different sensory systems that can be affected with sensory processing disorders. And it is different than autism, although they can go along with each other. There's also oppositional defiant disorder, which is oftentimes when a kid is trying to demonstrate their sense of independence and control, but they're doing it in a way that is over what would be expected. So they're always annoyed and irritated. They're causing problems. They're actively defying people who are in positions of authority, and they're refusing to comply with rules and norms that are being placed in front of them. And this is, you'll see this with terrible 2s, 3s, and 4s, and even kids who are going through teenage rebellion. However, if it's occurring several times a week for at least 6 months, then that's more than just going through a rebellious phase, and it's more than just going through a terrible 2s, 3s, and 4s, that it might be an actual disorder. When it comes to anxiety is where they're looking around, they're scanning the environment, they're paying attention to everything else inside and outside their body, and that could look like inattention as well. However, it doesn't mean that they have ADHD. It could be that they actually have anxiety because maybe they're more anxious and they're hardwired to be more anxious. Kids who are also depressed may seem like they have ADHD. Depression is they get slowed in their thinking, in their movement, in their memory. And so they seem like they're absent-minded. They seem like they're not paying attention because everything in their brain is more slowed. The hypothalamus helps to take in information in their brain, and it helps to make sense of it and helps to store it. And when people are depressed, the hypothalamus literally shrinks. So those are things to really keep in mind, because those are all things that can look like ADHD. And then autism spectrum disorders, those are things that can occur as young as you can see it from infancy. And these are kids who they not only have, they get stuck in very rigid routines, but their speech might be delayed. Children with ADHD don't necessarily have speech delays. They also have significant issues with social interaction, but that can also be the case with ADHD, that they have a hard time interacting and socializing with other kids because they're developmentally more immature when it comes to ADHD. With autism, they might either have no desire to socialize, or they have a desire, but they don't know how to. So I know that's a whole bunch of information, but I think it's really important because there's a lot of childhood disorders that look very similar. And you can have one disorder and you can have more than one disorder. So you could have ADHD, anxiety, and autism. You could have autism and ADHD. You could have depression and ADHD. So it's really important to tease those out and to make sure that you know what you're dealing with, because each of them will have a very different intervention once you look at that. So thank you. If you have any questions, please post them below, and thank you so much for watching.